Hello, thank you for accessing this video on fire risks and vulnerabilities as part of National Safeguarding Adults Week. My name is Laura Kane-Andrews. I'm the Safeguarding Lead for Hampshire and Isle of Wight Fire and Rescue Service. This video and the content within it is applicable for any professional within any sector. Whether you're a housing provider, a social worker in adults or children's services, whether you work within a hospital setting or a community health setting, if you are supporting members of the public and members of our community, this video will be applicable to you to hopefully provide you with a little bit of additional knowledge and upskilling in regards to what we have identified makes your service users or your residents more vulnerable to having a fire. At Hampshire and Isle of Wight Fire and Rescue Service, we have got a strategic objective of protecting people and protecting those people who need it most, those that are at the greatest risk of fire and those who are vulnerable. The reality is we need your support from a partnership perspective to do that. You are in a position where you are already supporting individuals within your day-to-day role, and we are hoping to be able to work with you to support you in identifying what may make those individuals more at risk of having a fire, and what advice and guidance we can provide and you can provide to them to hopefully try and reduce those risks, and how we can work together from a partnership perspective to support those individuals. You may already be aware there is a 4 local safeguarding adults boards fire safety development group that meets on a quarterly basis to try and pull together best practice and learning from fires that are happening within our local area. We review as part of that group any fire incident that involves a near miss, a serious life-changing injury, or a fatality. And we pull out learning from those cases, and we pull out data and vulnerability factors to be able to build a picture of what is happening within our local area. We recently completed a thematic review of the cases that we reviewed between 2022 and 2024. And as part of this video, I wanted to share some of the key statistics from that review with you. So out of the incidents that we reviewed during that time period, 44% of the individuals who had a fire incident had needs of care and support. 22% of individuals were in receipt of care and support services at the time of their incident occurring. 71% of individuals lived alone, and 11% of incidents there was no smoke detection in the property, and another 11% there was no functioning detection. So there was alarms installed, but they weren't working. 31% of the individuals had smoking as a risk factor. 42% of the individuals had a physical impairment. 42% of the individuals had poor mental health as a vulnerability, and 36% of individuals were using alcohol or substances. The reason I wanted to share those statistics with you is because, as I said, you are out there already on a day-to-day basis working with individuals who are probably presenting some of these risk factors and some of these vulnerabilities. Now, I'm not saying that every person who smokes is going to have a fire, or every person who has poor mental health or a physical impairment is going to have a fire. But what we need to be able to understand is, what do those vulnerabilities mean for the individuals that you're supporting? And in order to do that, we are asking professionals such as yourselves to be aware of those risks and to consider that from a person-centred perspective. The work that we've been doing with our partners over the last 3 years has helped us to pull this thematic review together, but there are also previous thematic reviews that I would like to make you aware of. So the Fire Safety Development Group initially did a review of fire incidents between 2015 and 2018. There was a second review of incidents between 2019 and 2021, and then the most recent one of 22 to 24. You can access those thematic reviews on our website at Hampshire and Isle of Wight Fire and Rescue Service, or on your local Safeguarding Adults Board's websites if you wanted to look a little bit deeper and understand the incidents and the reviews that we have been completing. What we have tried to do is figure out how we can make this an easy to embed concept within your day-to-day work, when we know that there is so much that you do to support members of the public already. And in order to do that, we have identified 3 categories of fire vulnerabilities that we are hoping you will be able to use when you're working with individuals in the community, and when you're working with them to try and understand what do their vulnerabilities mean for them in regards to fire. So the 3 categories, that we're looking at is the individual. So what is going on for that person in terms of their risk factors? So we're looking at things like their physical impairments, their cognitive abilities, their mental health needs. what's going on for them as an actual person that might mean that they are either at an increased risk of a fire starting, or their ability to react and respond or understand a fire situation may be impaired. We're then looking at behavioural risk factors. So that normally falls into two categories of what somebody is or isn't doing. So we're looking at things like smoking, alcohol and substance. We're looking at hoarding behaviour. We're looking at overloaded electrical sockets, or whether they sit too close to portable heaters or gas fires, whether they use emollient creams, for example. What are they actually doing or not doing that may increase their risk of a fire starting, or may potentially impact their ability to evacuate and respond in the event of a fire? And then the third risk is the environmental risk factors. So what's going on for them in the environment that they live in? Do they have medical oxygen? So they've got oxygen cylinders in their property. Do they have smoke detection? Does it work? Have they got overloaded electrical sockets and daisy chaining extension leads? Have they got hoarding within their property that affects their ability to move around safely? Have they got hoarding in their kitchen that affects their ability to cook safely? We're effectively trying to move to a position where using these three categories of fire vulnerability means that we can understand what that means for somebody in a lot more detail. Instead of making a sweeping judgment of, well, that person is or isn't a fire risk, we actually need to look at, well, what does that mean for somebody? What does somebody's physical impairment mean for them on a daily basis? How does somebody manage their smoking behaviour? How does somebody manage their home environment if they have got poor mobility and they've got trip hazards? What does that look like for them? And by having these three categories of fire risk, it helps us to have those conversations. It helps you to have those conversations and to record what that actually means for the service users that you are supporting. In order to support that being embedded in day-to-day practice, the local Safeguarding Adults boards created a 4 LSAB multi-agency fire safety framework. Now, this guidance document has been in place since 2021, and it was first created to be a frontline useful document to provide realistic support and guidance for the effective management of fire risks. As I said in relation to this video, it is applicable to anybody working in any sector, and that applies to the fire safety framework as well. It gives you an overview of the fire risks and vulnerabilities that we are seeing locally, similar to what I've just talked you through. And it also then includes a couple of risk assessment templates. So the first one is a person at risk fire risk assessment, which effectively is a risk assessment in order to try and identify what are those vulnerabilities. What is it that that person is experiencing in terms of their mental health, in terms of their physical health? What's happening for them in terms of smoking behaviour? Do they have smoke detection in their property? Is hoarding a concern? And it asks some specific questions in relation to what do we need to understand about those risk factors, and what control measures do we then need to consider. The second risk assessment template in the fire safety framework is an individual smoking risk assessment. So if smoking has been identified as a risk factor for somebody that you're supporting, there is a dedicated smoking risk assessment in order to try and understand the risks about that behaviour. So this will ask questions such as, how does somebody light their cigarettes? Are they using matches? Are they using a lighter? Is there a risk in regards to cigarettes being dropped onto their person, onto the floor, onto their furniture? Has burn marks, for example, been seen? Do they need supervision and support whilst they are smoking? How do they dispose of their cigarettes? What are they using as an ashtray? Where are they putting those discarded cigarettes? And that again helps professionals such as yourselves to really focus on what that fire risk is for that individual. What does that mean, and how can we and you support them in order to try and manage that risk? As with all Safeguarding Adult Board guidance documents, this is an overarching framework, and it is down to individual organisations to look at the framework and determine how it works best for them. The risk assessments in the framework can be used as they are. You can take them from the guidance document and you can embed them into your organisations as they currently are, or you can use them as a guide to develop your own or to amend your existing risk assessments to ensure that fire is embedded within there. The hope of the fire safety framework is to provide, as I said, that frontline tool for professionals to be able to use this guidance document to support them with the individuals that they are already working with, so that fire is embedded as a concept that is considered and is risk assessed on a regular basis. The other thing I wanted to make you aware of today, which you may already be aware of, is the Home Fire Safety or Safe and Well visit offer from Hampshire and Isle of Wight Fire and Rescue Service. So a home fire safety visit or a safe and well visit is a person-centred home fire safety visit based on that person's health needs, their behavioural factors and the home environment. So those three categories that I have already spoken to you about today. So a safe and well visit or a home fire safety visit is an offer that we will provide and a visit that we will complete to an individual within their home setting, where we will look at the potential fire risks and vulnerabilities that somebody may be experiencing. We will check that somebody has got working smoke detection and, where necessary, install additional smoke detection or replace the smoke detection that is there. Discuss with them what their escape plan is, what their plan B is if they are unable to evacuate, how do they keep themselves safe. If fire risks in regards to smoking are a concern, we can provide fire retardant bedding or blankets and throws to help eliminate that risk. And of course, give advice on any risk factors that we identify, such as falls prevention, smoking, how to manage their fire risks within their property. And the little flow chart at the bottom is effectively what we are asking professionals such as yourselves to embed within your day-to-day work with individuals. We're asking you to have an awareness and a knowledge of fire risk and vulnerability so that you can identify that for the individuals that you're working with. We're asking you to complete some form of fire risk assessment within your organisation with the individuals that you're supporting. And we're asking you to consider and then refer to us for a safe and well and for a home fire safety visit. This means that we can work with you in partnership to identify those risks, but you are already in a position to support those individuals on a longer term basis and help embed that advice and that guidance into place. You can make a referral for a home fire safety visit on our website at Hampshire and Isle of Wight Fire and Rescue Service. There is a dedicated safe and well referral section. Please include a contact number for somebody so that we can arrange that visit. We have to have the consent of the individual to go inside their home. This is not an enforcement visit, it is an advice visit. So they have to be present for it to be person-centred and they have to agree to that visit to taking place. So we need to be able to arrange that visit at a time that is convenient for them and for us. If you want to be present during that visit, that's absolutely fine. We can arrange that visit with you directly. And if you would like confirmation once that visit has taken place or what the outcome of your referral was, then please let us know your details and we will provide that to you. I hope that that information has been useful. I appreciate this is a very quick video in regards to just the key messages of fire risks and vulnerabilities. We do offer partner agency training. My colleagues in our community development team provide training on a monthly basis that can be booked on via Eventbrite. So if you have got additional training needs for your team, you would like to know more about fire risks and vulnerabilities, please do book on to one of those training sessions. It takes about an hour. It's a completely free training session, but it goes into a little bit more detail of what I have given you a very brief overview about today. What I would please ask is please consider fire risk within the individuals that you are supporting. Please have some form of fire risk assessment and have a process for home fire safety visit referrals within your organisation. If you have any questions or any concerns, please do contact us at Hampshire and Isle of Wight Fire and Rescue Service. We'll be more than willing to talk to you about anybody that you are currently supporting or how we can work with you a little bit closer. Thank you very much for your time today. I hope it was useful. Please do contact us should you need anything. Thank you very much.